So, what I want to share with you today is a little insight in something that we call dermal carving high definition lipo. There's a lot of questions that we get from patients around this, from surgeons coming to the courses, because at the end of it, to summarize that or to wrap it up, dermal carving basically means high definition lipo without thermal energy. A high definition lipo is brainchild of, I think, probably one of the smartest and most advanced surgeons on the planet, Dr. Alfredo Hoyos from Colombia, who basically, I've learned so many things from his concepts, and he is the one who basically set the first step into this. The little variation, and I think we all we try to keep the ball rolling, that I introduced into my interpretation of this was to abstain from using what we call an energy-based device. What's an energy-based device? An energy-based device is something with heat. So conventionally, you'll find phaser, J-plasma, body type, which works with laser, ultrasound, or radio frequency. Now, I'm often misunderstood when I'm communicating with surgeons, and I've got nothing against these technologies, and I use them for a lot of things, but I just think that sometimes we may want to look at the other side of the coin and see what possible damage we can do with these. So where do we do high definition? High definition is structure, liposculpture. I'll show you a few slides in a second to explain what that precisely is. I think limited to people who have a subcutaneous pinch of about 3 centimeters. If it's more, you run real risk that they look like turtles afterwards. And if they have stretch marks, I'd rather give it a miss, or extreme muscle distension, because you can't solve that with lipo, you just make it worse, and then it's better to do tummy tuck. And we classically in female patients limit our body contouring procedures to a BMI of 30, which is kind of self-suggesting, because if your BMI is over 30, your pinch is probably far higher than 3 centimeters too. Now, my aesthetic suggestions or preference is, in females, I try to only do the vertical lines. I prefer not to do the horizontal lines, because that gives a rather male appearance, at least for my liking. It's a subtraction principle, so to simplify that, we leave strategically a little bit more fat behind in the center, overlying the muscles, which that looks like abdominal muscle. There's a lot to be said for waist definition and what we call BIC, below iliac crest, lipo shaping. That's a topic for another day. And I love to combine that with hip fat grafting to get a more female overall shape and silhouette. Now, the controversial point is, do we need energy? I'm not saying, again, energy has got a potential. What energy can do, phaser, J-plasma, body types, you name it, we've seen it. They kind of apply heat in the subcutaneous tissue. This heat causes a controlled thermal trauma, and that can cause a certain degree of skin retraction. How much, first, is a bit controversial. However, but I think what we need to bear in mind is dermal heating doesn't only cause skin retraction. I think it's also a very strong inflammatory stimulus, which on the other side you might pay with fibrosis. And the reason I really got to that is currently 2 out of 3 body contouring, usually BBL surgeries, I do a redo cases, because that was unknown a decade ago when I started doing this. Now everybody wants to do it, and I get all the secondary cases, and many of these patients have had phaser or whatever. So when you work on this as a second surgeon, that can be a bit hard, because often it's you have the feeling you're sucking out bone. So this is why over the years I got a bit more awareness of the problem, then we try to find a way, to do this without really using any thermal energy, get a more predictable results, less inflammatory complications. You never get 0 complications, but you want to lower them as much as you can. But we still have a very forthcoming use for energy-based devices in arms, lower back, and the thighs. We just don't try to uncritically apply it all over the place. So here you've got a small comparison of a vertical with a so-called 6-pack etching, which I think for females, I don't know, it's not my cup of tea, but that may be aesthetic liking. And here you see more or less, what we set out to do. firstly to mesh the subcutaneous tissue area overlying the abdominal muscles. And what we do then with a very, very targeted first debulking of the tissues, and then you see here along the edges of the rectus abdominal muscle, we go very, very superficial, more superficial than you should actually go in a normal debulking lipo. And this superficial targeted lipo causes skin retraction overlying the abdominal muscles, and then you get the effect. I mean, to demonstrate this is why it says subtraction lipo. Look, in here in this case, in the central area, where you want to be a bit more careful anyway, because you get a lot of problems with the skin in that area if you're too aggressive. Too much lipo in one place is worse than too little. And then along here, the side edges of the rectus, we really go paper thin, leave it a little bit thicker on the side, and then we get a kind of, I think, very nice shadowing of the abdominal muscles. And you see this, in the end of the day, what I'm doing is I'm just leaving a bit more fat behind in an area where I'm worried about loose skin. So here I leave about 1.5 centimeters, here I leave 5 millimeters and 1 centimeter on the side. And if you say the same girl, it's like 3 months later, it gives you the illusion of a toned abdomen. I think it's a wonderful way to get a good lipo-shaping result out of patients, where I say, look, if you just want to uncritically suck all that fat out, you probably end up with a tummy tuck, or definitely a much less athletic procedure. And the central fat in the abdomen, which is usually your enemy, can suddenly become your friend. You see here the same thing. It's shadowing the lines of the abdominal muscle, leaving a little bit more bulk of fat over the rectus muscle, and getting the illusion of rectus abdominal structure. So again, you leave your fat flap a little bit thicker here where you want to leave it anyway to have a nice stable skin, and then you carve in here, and then you get your dermal carving etching effect. This is something that we quite often see is I think, this is something that you need to bear in mind. The technique is a bit susceptible to hyperpigmentation. I really recommend you to do nothing. I mean, this goes better over time. It's often very, very superficial hemosiderin deposits, and they kind of get over time, or you can use a skin bleach if you want, but I think conservative is usually best. If you want to do something, you can work with hydroquinone and retinol combination. I think currently a more common problem that we see is maybe over-compliant patients, you know, with all these surgical forums. You know, we see more and more people who think the more compression the better, and that's wrong, because too much compression can actually damage the skin. Yeah, so skin burns over lipo don't really come from the lipo, they come from the compression. So always advise your patients to take the compression of one hour a day for the shower. Massaging, I think self-massaging is probably best, but highly underestimated. And what we really like to do is, if patients tolerate that, to give them a couple of weeks ibuprofen, of course with omeprazole, and I feel that significantly reduces your fibrosis problems. So to wrap it up, dermal carving, to simplify and demystify that, it's basically an etching with subtraction. You win your body shaping game with female patients on the waist, and very, very important, always respect the iliac crest as a border to what you can do. I hope you like the idea. Maybe we've opened your mind for that. Denda Vecchio and I would love to welcome you to our next hands-on live surgical training in Marbella, presumably in April 2021, or otherwise great to welcome you in Marbella for our next big course at 24, 26 June 21. So stay curious and see you in Marbella.